I'm Artemis Teagan, and I am the director of the Artemis Center for Family Therapy. We're going to be meeting today with two of my very esteemed colleagues, Dr. Marjorie Rand and Dr. Dennis Coffey, to talk about mindfulness in clinical practice. So I'd like to introduce Dr. Marjorie Rand. She's been in private practice for about 35 years and specializes in integrative body psychotherapy. And my other colleague, Dr. Dennis Coffey, who has been in private practice as a psychiatrist for the last 30 plus years and is also at San Pedro Mental Health. And I wanted to invite both of you to ask questions about how we use mindfulness in our clinical practice.
On the subject of yoga, the most basic breath that we start out with is simple observation of the breath without trying to change it, non-judgmentally observing the breath.
I work with a lot of trauma survivors. So what they present with is a lot of anxiety and panic disorder. So it is the very first thing that we start working on. Typically when I work with individuals like this, they have a lot of restriction in the upper body. I spend a lot of time helping them to just focus on belly breathing first, not restricting their breathing, not holding at the top, not holding at the bottom, learning how to have their breath be a little bit more continuous. That whole process, building a good foundation, takes a few weeks for them to do that, but it's fundamental. And if they get it, it is core to helping them move into mindfulness techniques.
Well, and I treat a lot of survivors of childhood physical and sexual abuse, and I refer a fair number of those to you. Can you tell me how you apply mindfulness in your treatment of those?
Well, when I have trauma survivors, particularly people who have had rape or sexual abuse issues, what they're often presenting with are flashbacks, nightmares. There's a lot of re-experiencing going on, and because that's going on, they're doing a lot of avoidance, whether that's substance abuse, whether it's disassociation, engaging in other addictive types of behaviors. So I spend time in the psychoeducational part teaching them about learning to stay present. This is not something trauma survivors want to do. It's very counterintuitive. So teaching them that in session we can spend small titrated amounts of time staying present with what's coming up, whether it's flashback, whether it's a sensation, whether it's a fear of impending doom, teaching them to kind of tolerate and roll with what's going on right now in a non-judgmental way without having to attach a lot of value to it and without having to react to it. In other words, can we hang out for a few minutes with our breath and our five senses to help keep us grounded in the present so that you can manage what's coming up, and that'll be evidence that you got through it in session without having to do something self-destructive, right? So that becomes fundamental to them recognizing I can be present with my feelings, I can tolerate what's going on, and I don't have to run from them, and I don't have to chase them down and try to extinguish them.
Yeah, and I can testify that they find this very, very helpful. You've been a great assistance in many of these patients.
Thank you, thank you. I don't think there's anything more powerful than a trauma survivor learning that their internal world doesn't have to devastate them, that there's a different reaction that you can have, and also that the reaction can be not reacting at all. Excellent questions. Thank you so much for being a part of this. I really appreciate the participation. It's wonderful to have you here today.
It's a privilege.
Thank you.
Yes, happy to be here.
Thank you.